Every year, an estimated 15 million people die needlessly as a result of communicable diseases. More than a quarter of these deaths are caused by AIDS, TB, and malaria. Almost all occur in the developing world. Most are dying because they don't have access to medicines and because there aren't enough health workers available to care for the sick. They are dying because the world believes the challenges are too big and the solutions too costly. Dignitas believes differently.
The only way to overcome the real health disparities and the inequity in access to health care that we have is actually to think about how to do things differently.
There are massive challenges around human resources. On the continent of Africa alone, there's a shortage of 3 million healthcare workers.
I like to think of Dignitas as problem solvers. And of course, in this setting, with limited human resources for health, one physician for about every 50,000 of population, no shortage of problems to solve.
Dignitas believes that by employing new ways of thinking, by applying intelligence and innovation, we can leapfrog over global health challenges. By providing frontline medical care and training, conducting high-impact research, and vigorously engaging policymakers, Dignitas is saving lives and improving the way healthcare is delivered in the developing world.
I think what makes Dignitas special is that we're on the ground and actually managing patients. And what we've managed to develop is the capacity to actually study what we do.
Dignitas has shown that decentralization, taking treatment to communities, working with community healthcare workers works.
Really, at the end of the day, it's about a system that can deliver the kind of care that we all know is appropriate to patients when they need it, where they need it. And building that up block by block, brick by brick, person by person.
It's important for Dignitas to both advocate on behalf of people whose voices aren't heard and also to amplify, because we hear them as doctors and as humanitarians. We sit with them and we hear their stories.
It's about policy engagement, it's about advocacy. It's about taking the experience, marrying it with the evidence and the knowledge that we're generating with the research, putting them together, and then making really credible arguments at the national and at the international level to improve policy for the people on the ground.
There are solutions, there are answers, there are ways to make it better one step at a time.
It's bringing compassion and evidence and rigor together.
The biggest and most important outcome is not only improved lives of millions of people, but also improved knowledge, improved health systems, not just for a day or a week or a year, but for generations.
Healthy people build vibrant and thriving communities. Children who are strong can learn and play. Families that have hope plan for their future. Your support will not only enable Dignitas to provide millions of people access to treatment and care, it will help lay the foundation on which they can build their lives and dreams. Together, we're changing the face of global health.
Dignitas is changing the face of global health.
One innovation at a time.
One innovation at a time.
One innovation at a time.
Help us change the face of global health.
One innovation at a time.
One innovation at a time.
At a time. At a time.
Together, we'll change the face of global health, one innovation at a time.